Hi, my name is Dustin D. I'm a professor of medicine and ophthalmology and medical social sciences here at Northwestern, and I've been here for 12 years. And I want to talk a little bit about the conference in Seattle at ARVO. We had 2 oral presentations and 1 poster session. All 3 were funded by the National Eye Institute, which I'm very proud of. But more importantly, all 3 presenters were minority students, and they received minority travel awards, which is a very competitive process at ARVO. And I'm very proud of the students that presented our work. So I want to talk a little bit about the work that Miriam ID, who's one of our second-year residents, did on glaucoma. She presented some work on pressure lowering in minorities, which disproportionately impacts those that are Black and Hispanic compared to whites. Additionally, Kunal Kanwar, who is a second-year medical student, presented his work that is also funded off of our study called Health Doc. This is the health disparities of 3 common ocular conditions funded through the National Eye Institute. And then finally, Azra Achardi did work on diabetic retinopathy and showing quality metrics and differences between minorities and white patients, and showing that we can move the needle forward.
My name is Kunal Kanwar, and I'm a third-year medical student at the Feinberg School of Medicine at Northwestern University. And this year I had the opportunity to go to the ARVO conference in Seattle. This year I had the opportunity to do an oral presentation on the social determinants of health and optic nerve evaluation in patients with primary open-angle glaucoma. Having the opportunity to go up on stage and present my work has been truly inspiring, truly rewarding after the year of hard work that went into doing the actual research. My mentors have been absolutely phenomenal. Dr. Dustin D and Dr. Paul Breyer have been with me every step of the way in the conference, guiding me, looking how to look at research, but in addition, giving me that independence and that opportunity to be able to be my own independent researcher. And so for that, I'm really grateful. And I feel like being a Northwestern student and having the opportunity to go to ARVO is what really makes it so special.
Hi, my name is Bonnie Huang, and I'm a 4th-year medical student at the Northwestern University Feinberg School of Medicine. I'm very grateful to have had the opportunity to present my work at ARVO. I've been working with Dr. Amani Fauzi, my research mentor, on a project where we used high-resolution retinal imaging techniques to better understand what happens on a cellular level in diabetic retinopathy, the leading cause of blindness for working-age adults. In particular, we focused on imaging vascular mural cells in living human eyes in order to study the timeline for the loss of these cells in diabetic retinopathy. We found that these vascular supporting cells begin to disappear from retinal blood vessels very early on, before the appearance of other clinical signs of diabetes. We hope our results will help facilitate the development of therapeutics to preserve these critical cells and potentially prevent vision loss from diabetes. For this more recent project, we were also studying diabetic retinopathy, but this time we were more focused on the wall of the retinal blood vessels and the timing and relative impact of hypertension versus diabetes on vessel wall thickness. We found that hypertension may be an early driver of wall thickening, while changes specific to diabetes may drive wall thickening in later stages of diabetic retinopathy, which highlights the importance of optimizing blood pressure control in individuals with diabetes prior to the onset of diabetic retinopathy. Overall, attending ARVO has been a valuable experience, and it was wonderful to be able to meet so many people and to learn from so many great talks and posters. Dr. Fauzi has been a fantastic mentor. I have been working with her since my first year of medical school, and she has been extremely supportive throughout my medical journey. She is always available to discuss ideas and always has helpful feedback. And working with her on research, as well as joining her in the clinic and operating room and seeing the impact she has on patients and their vision, has been really inspiring.